trip for essentials? Good luck. Consider this: coronavirus-fueled panic buying. Empty shelves, lineups that keep going and going and going.
Excuse me, sorry.
Not to mention a tight squeeze in that crowd, even as public health experts urge everyone to avoid contact.
Yeah, it seems about a little bonkers in there now today.
There's lots of people and more than normal, even on their busiest day.
I saw people with like 5-6 packages of toilet paper.
Indeed, with so many users sharing pictures online showing toilet paper shelves empty, unfounded fears of a shortage run rampant.
Toilet paper isn't the only thing running low in some stores, like non-perishable food items, tomato sauce, and pasta in this store. It's nearly all gone.
But stores are restocking every day, and officials across the country promise
Right now, all trucks are delivering goods, and we don't expect any shortage.
So, what's driving the panic? This medical anthropologist blames the fear of a mysterious virus and the need to do something to help.
Hoarding behaviors in the context of an outbreak are not helpful.
Problem is, overbuying prevents others from grabbing their own supplies. But it gets worse, like those reselling cleaning wipes online at outrageous prices.
I'm profoundly disappointed in people who are hoarding and then selling online. I think that's just offensive.
And don't forget, even in Italy and other countries worse hit by COVID-19, stores selling essentials remain open, while everything else grinds to a halt. In Canada, stocking up may be helpful, but buying all in sight makes a crisis worse. Thomas Dagg, CBC News, Toronto.
Here's another way widespread panic can harm your community. People who think they might have the virus are showing up at hospitals and assessment centers when they really shouldn't be there. Christine Burak shows us why that's a problem.
They're lining up, masked and worried they might have the virus. Inside, there's no waiting room. A registered nurse is screening patients to determine if they need to see the doctor.
Yesterday we saw about 170 patients, and today it looks like a lot more.
But most of them were turned away. Doctors are seeing patients based on risk factors, not fear.
I think there's a tremendous level of anxiety, and I think we're trying to control that anxiety as well.
There's already a lineup of cars trying to get into this assessment center, and doctors inside say they're not just swabbing everyone.
Health officials warn their supply of testing swabs is limited. Turns out Italy is a major supplier, and the country's been locked down by a coronavirus outbreak. Today, the city of Ottawa did a dry run of drive-through assessments and opened a larger center, but there are rules.
Patients cannot just come in walking in for testing. If they do, we tell them to call public health and get direction from them, and we send them home.
At the same time, public health call centers are being overwhelmed. Wait times are over an hour.
There are obviously a lot of people who are concerned about potentially having COVID just on the basis of their travel history or exposure.
Before making that call, some health officials are asking Canadians to go online, find out who's most at risk and who's eligible for a COVID-19 test.
We have a website. The federal government has a 1-800 number. Do not phone 811 unless you have traveled outside of the country and have developed fever or new cough.
Rules vary by province, but doctors warn, much like an MRI scan, not everyone who wants a test needs one. Christine Burak, CBC News, Toronto.
Okay, ready for some more practical advice? Let's bring in infectious disease specialist Dr. Michael Gardam. And Dr. Gardam, the danger here, as we saw, is that people who aren't infected will overwhelm the system. So how can people assess their symptoms at home to figure out what to do next?
Yeah, really it's about, how sick are you? And so, obviously if people have difficulty breathing, very high fevers that aren't breaking, if they're so tired or weak that they have a hard time getting out of bed, those are all symptoms that we say, you really should be going to see a doctor. But for very mild symptoms, if you come and see us, there's no specific treatment for this. So we're just going to send you back home again. So it's really about how sick you are.
Now, there are people who are in the so-called compromise group, or they're looking after someone who is. Is the criteria different for them?
No, not particularly. I mean, it really comes down to if people are ill enough or if there are other extenuating circumstances, when they go to an emergency department, the doctors may decide to test them. But by and large, we're still testing largely based on travel to other countries.
So a quick question here, if you're not sick enough to go in, you don't have the symptoms you mentioned at the beginning, but you're still feeling, what might be the cold, the flu, you're not sure, what do you do then?
Yeah, the message there is the same one we've been saying for years, which is stay home, and we really mean it this time. Nobody wants to see you at work walking around coughing, so you need to stay home until you are feeling well enough to go back.
I like that. We really mean it this time. Dr. Michael Gardam, thank you.
Thank you.
Around the world, the number of COVID-19 cases continues to climb. As of this evening, more than 142,000 people have been diagnosed with the virus as the world hits a grim milestone, more than 5,000 deaths. Some good news, though, more than 70,000 people have recovered. In the United States, more than 1,200 have been diagnosed, 43 people have died, and 6 have recovered. Those numbers may go up as the United States improves its testing process, something Donald Trump announced today when he declared a national emergency. The CBC's Katie Simpson has more from Washington.
The president and his coronavirus team are significantly ramping up the fight against the disease.
I am officially declaring a national emergency. 2 very big words. The goal is...
The announcement unlocks $50 billion in federal funding and allows for better coordination with state governments. The Trump administration is also partnering with the private sector to get more Americans tested, promising to set up new drive-through testing sites like the one that just opened at the center of the outbreak in New York State. And this
new approach to testing, which will start in the screening website.
An online survey patients fill out to see if they actually need to be screened.
We don't want everybody taking this test. It's totally unnecessary. And this will pass.
Donald Trump appeared to contradict his own advice, saying he is likely going to be tested even though he doesn't feel sick, and repeatedly ignored the advice of experts by shaking hands with several of the speakers at his news conference.
Great job. Thank you very much.
The president has been criticized for appearing not to take the crisis seriously,
Okay, I like that.
and for responding slowly. The U.S. has struggled to test large numbers of patients because of flawed testing kits, a lack of supplies, and strict regulations.
The system is not really geared to what we need right now, what you are asking for. That is a failing.
Even if it is a failing, Trump says it's not his fault.
I don't take responsibility at all because we were given rules, regulations, and specifications from a different time.
Lawmakers are putting even more resources into this fight, agreeing on new legislation that guarantees testing is free, some workers get paid sick leave, and kids who rely on school meal programs will continue to be fed even if classes are canceled. Katie Simpson, CBC News, Washington.
In Europe, efforts continue to combat the spread of the virus as the World Health Organization called the continent the new epicenter of the pandemic. In Italy, officials reported the highest daily death toll yet. 250 people died in the last 24 hours. That brings the total to more than 1,200, with nearly 18,000 infections overall. A nationwide lockdown continues with all shops closed except supermarkets and pharmacies. In Spain, the Prime Minister announced a 2-week state of emergency. The goal is to mobilize the military and other resources as the number of infections jump to 4,200 with 120 deaths. The announcement allows the government to limit free movement, legally confiscate goods, and take over control of industries and private facilities. And the Olympic torch relay is on hold because of concerns around coronavirus. It started yesterday at a pared-down ceremony, but Olympic officials suspended the remaining stops after a large crowd turned out for the opening leg in Greece. The flame will still be handed over to Tokyo 2020 Games organizers in Athens on Thursday, but no spectators will be allowed. So maybe you're one of the many Canadians who's facing self-isolation, and that means a few adjustments.
Make sure you're not sharing any dishes with anyone who's sick or may be infected.
From cleaning counters to clothes, the do's and don'ts of self-isolation. Plus,
I am concerned for my community and what this will do over the long term.
The case for containment, Seattle versus Vancouver. How COVID-19 is playing out in two close-by West Coast cities. Canceling prayers and reducing services. The challenge of keeping the faith in the age of COVID-19. We're back in 2.